Recorded Books and One Click Digital present What Your Doctor May Not Tell You About Fibromyalgia by R. Paul St. Amans, M.D., and Claudia Craig Marek. Narrated by Nelson Runger.
The book begins with the following preface by Dr. St. Amans. This book was written with some hesitation. The focus of my practice has always been on helping the patients who came to me directly. In the past, I avoided publicity for my work because of the controversy I knew would arise from treating a no-name illness that other doctors didn't believe existed. Because of this skepticism, I even hesitated to discuss this strange illness with my colleagues and the large medical group I headed. But I soon realized that I had no choice but to ignore their skepticism because the results are what really count in medicine, and I was getting them. I was on my own. I drew sketches to help my patients better understand their disease and the course of treatment I recommended. However, my fibro-fogged patients needed something written to review and to bring home to their families. It became necessary to write descriptive patient papers. These were copied and circulated among many fibromyalgics who were not my patients, as well as their friends, their cousins, and their neighbors. In my wildest dreams, I could not have anticipated the number of patients these papers would bring to my office from all over the United States and eventually from around the world. When the name fibromyalgia was coined, about 17 years ago, I gratefully adopted this nomenclature, misnomer though it was. Finally, a real name was given to this old disease and helped it to gain acceptance from some members of the medical community. This led to my coming out of the closet, since now the disease officially existed. Though my approach was unconventional and not in accordance with the party line, I was increasingly asked to speak and write about my experiences with fibromyalgia and its associated conditions, the most prevalent of these being hypoglycemia, or low blood sugar, a common accompaniment to fibromyalgia. As I studied and learned more about the nameless disease we now call fibromyalgia, I realized that I also had it. Later, I was able to identify the condition as one of my father's legacies. It was he who carried the gene and unwittingly passed it on to my two sisters and me. Over the span of a few years, I realized that one by one each of my 3 daughters were developing the same symptoms as they grew older. Illnesses take on special significance when they strike near to home. My family's traits obviously drove me to hone my skills a bit more sharply.
Sample complete. Ready to continue?